Today on Community Watch, I have a conversation with Dr. Gary Voccio, who is the Public Health Director, I have to read this, Public Health Director for Northwest Georgia Public Health. Wonderful conversation, important one too, because this is the time of year when people begin to get sick. So you want to hear this conversation, Community Watch starts now. Welcome to Community Watch. I am thrilled to have one of our regular guests back with us today, Dr. Gary Voccio, and here is your very long title, Public Health Director for Northwest Georgia Public Health. Welcome back.
Correct, thank you. Glad to be back.
All right, so I know you have some health issues that you want to bring up, but I need some updating first. Vaccines.
Mm-hmm.
All right, so I know that a new version of the COVID vaccine was ready, really, I guess, in the summer, but was available this fall. I have been pretty good about getting my boosters and vaccines when they were available. This time, though, I actually got COVID in September before I could get the new vaccine. It was not it was a fairly mild case. I had a couple of rough days, but it wasn't too bad. So my question is, when should I get the new vaccine, given that I had COVID in September?
You can wait. You can wait 4 weeks after you have COVID, up to 6 months, but it's recommended to get it around 4 to 6 weeks after you've had COVID.
All right, so I should be getting it pretty.
Yeah.
I can get it now,
should,
actually.
Yeah.
Where are we with COVID vaccines now?
Well, look, unfortunately, for COVID vaccines at least, only approximately 20% of the population is getting the COVID vaccine. Influenza vaccines are a little better. Around 35% of the population who is eligible. The 18 or over, it's about 30%, maybe a little above 30% population. For influenza vaccine, COVID vaccine is only 19% of the population, general population. And respiratory syncytial virus for the patients who are eligible, the older population, is around 40% to 45%.
So that's better.
It's a little better, yeah. I think the older population realizes the significance, more so because, sadly, the people who are dying of respiratory illness, COVID, influenza, or respiratory syncytial virus, are the older population, people over age 65. They die at a much higher rate. So I think that population is really attuned to the fact that they really need vaccinations. Unfortunately, the vaccination for COVID and influenza is quite low right now.
All right, so the flu numbers being low, are they lower than normal?
That's an interesting number. Right now, at least in our health service area, in the southeastern part of the United States, which is HHS 4, those numbers are below average right now. Nationally, the numbers are almost exactly where they usually are retrospectively, historically, except for 2 years ago. 2 years ago, we were well above the normal range, but right now, nationally, we're at an average number of percentage infection. It's around 1% of respiratory infections when are tested. And in Georgia, and in our southeastern United States district, HHS 4 district, it's a little below the average number. So flu numbers are pretty low. Hospitalization numbers for flu are low. Fortunately, we have not had any deaths from flu in Georgia currently, so which is good. Unfortunately, like I said, our influenza vaccine numbers are low, but historically we're at, in Georgia at least, a little below flu numbers, but influenza really doesn't hit until winter time, December, January, February, those times. So we're still at an early stage, at least, for respiratory virus infection, particularly flu.
And flu is not, I mean, it may be something that older folks need to be more concerned about, but really, flu is universal.
Yes, and that's why it's recommended anyone over age 6 months should get a flu vaccine. You know, and realize that the real young population, I mean, these are children, not adolescents, but children under age 5, they succumb secondarily to flu after people over age 65. So the elderly, the extremes of age are the people who are more susceptible to respiratory infection.
But given that the typical time of year for flu to really hit folks is coming. I mean, it's not here yet. It's coming soon.
Well, you know, really it starts around September. But the time frame, when you look historically, like I said, we're about a month away from where that blip starts going up the graph. You know, we're a little early yet, but it's coming. Historically, that's when we're going to see it, and we've seen it many times in the past.
And the flu virus is one that changes a little every year, right?
Yes.
I mean, based on what flu is out there.
It's called antigenic shifts and drifts, yes. And, you know, they measure that usually in the southern hemisphere. They kind of know what's coming. But that virus can change fairly quickly. But right now we're seeing more influenza A when they are able to test it. And it's a relatively small number when you go to a hospital or an office setting or a clinic or urgent care. When they test you, some of those centers are sending those results to the CDC. But right now, the influenza numbers are quite low. So we are seeing numbers that are historically where we've seen before.
Yeah. Now, the respiratory virus that you mentioned,
respiratory syncytial virus.
Okay. I've heard different ages for when that vaccine should be taken. I mean, what is the age range that?
It's 75 if you don't have any medical complications. Most people at age 75 has a medical complication. If you have medical complications, it's recommended to get an RSV vaccine at 65 or above. If you have asthma, heart disease, diabetes, any kind of neurologic disorder, history of stroke, etc., cancer therapy, you should get an RSV vaccine. Respiratory syncytial virus is a virus that, when I formerly practiced, we could not measure it. There wasn't any way to detect it. Now there is. And we would determine that if it wasn't a flu or a bacteria, then somebody had probably RSV or a viral pneumonia. And also, like I said, extremes of age. There are a lot of neonates in the hospital or hospitalized in the neonatal intensive care unit, the NICU it's called, who have RSV. And that's a very known complication in premature infants, RSV infection. Causes pretty significant respiratory infection in those neonates. And also the extremes of age, people over age 65 with medical conditions, or 75 years of age. It really takes a toll, and there's a fairly high death rate in the elderly population with respiratory syncytial virus. It's a much higher death rate than influenza or COVID.
And is that an annual vaccine?
No, you just need one.
Forever and ever?
Just need one. The early on recommendation was to get 2, but they backed off on that because apparently it's a fairly robust response, and right now they're just recommending 1 RSV vaccine.
And does that vaccine require a prescription?
No, it does not require, well, you know, that's a good question. We have them at the health department by order, so no, I don't think that is a prescription.
All right, because I was getting mixed messages about that as well.
That's a good question. I hadn't thought of that.
So the COVID vaccine rate is quite low. The strain that's out there now, and I know it's something that has changed multiple times. Is it a mild strain, or does it just depend on the
So
case,
far as what we're seeing, it is relatively mild. Like I said, hospitalizations are quite low, and the death rate is still pretty low, very low, as a matter of fact, for what we first saw with this pandemic. It's pretty low numbers for the COVID numbers.
Yeah. All right, so I've also recently had pneumonia. I don't know what's going on with me this fall, but I don't usually get sick multiple times in a season, but pneumonia got me a couple of weeks ago. And you're telling me before we started that I'll be hacking for another 4 weeks probably.
In my prior clinical practice as a practicing pulmonologist, when somebody came back to see me after I cared for them in the hospital and they were still complaining of cough, I typically saw them back fairly often, and on average, just from a single person anecdotal report, on average, it was about a 6-week time frame before somebody cleared their cough. It's just a time for your inner tissues, your lung tissues to heal, your immune status to get back to stabilization. A pneumonia really does destructive damage to your lung tissue. And just imagine if you had an infection on your arm or leg that was visible, how long it would take for that infection to clear, the redness and swelling to go away. Same thing is happening in your lung. So, it's a 6-week time frame on average to clear.
Tell me about pneumonia vaccines, because
Very good question. I was hoping you'd ask me that. I was going to start a very important vaccination for adults is the pneumococcal vaccine. And there are a number of them. They're called polysaccharide vaccines or pneumococcal conjugate vaccines. Depending on what you've had in the past, will lead you in discussion with your healthcare provider what you should get in subsequent follow-up. Usually there's two pneumonia vaccines, pneumococcal vaccines, like I said. There's the 13, the 15, the 20, the 21. They're going to develop other forms of that in the future, I've read. Regardless, pneumococcal vaccines are very important. Pneumococcus is still the most deadly pneumonia out there. It used to be called the captain of the men of death, as you recall. It's called the captain of the men of death. Pneumococcus, particularly invasive pneumococcal bacteria, kills people. It has a 20% mortality rate. So I will implore people to talk to your healthcare provider about getting a pneumococcal vaccine. Typically it's 2, depending on which one you've had in the past. Usually it's a year apart. One of them, the polysaccharide, I believe is a one-time vaccine only. But sometimes, depending on your medical conditions, you would need a booster. They're not really interchangeable. You should get an identical one if it's available. But if not, any form of pneumococcal vaccine would be recommended.
Okay. Well, we need to take a break here. So we will be back with Dr. Voccio and a lot more information. Do not go away.
While being a student athlete at Georgia Highlands College, I get to compete at a high level, as well as be a part of a supporting community.
Wearing the Charger orange and blue is more than about just a game.
Now you have an opportunity to make a gift towards the Georgia Highlands athletics community.
Being etched in stone as a champion last year meant the world.
Bringing it home to my hometown Amazing.
Your generosity will provide scholarship dollars and enhance the student-athlete experience.
Please donate to the Georgia Highlands Athletic Scholarship Fund.
Go Chargers.
Welcome back to Community Watch. I'm having a conversation with Dr. Gary Voccio, who is the Public Health Director for Northwest Georgia Public Health. And so we spent the first half of the show talking about vaccines and where we are in those areas. I know y'all do a lot more than vaccines. So what is going on health-wise that concerns you that we need to know about that I haven't asked you?
You know, in Northwest Georgia, and nationally in the state of Georgia, I'm concerned about, in general, overall people's health and well-being, particularly with obesity, the diabetic problems that go along with obesity, and people who are succumbing to diseases related to physical inactivity. I mean, you know, we have a great trail system here in Georgia, in Northwest Georgia, and in Floyd County, but there's not a lot of people. My wife and I walk these trails, and there's not a lot of people walking on them. And I think obesity is quite an epidemic and a huge problem in Georgia and nationally. And it goes along with you know, just the lack of physical activity. It's a mindset that in small part, people have to realize that they have to take care of their health, monitoring what they eat, the exercise that people need to do. It really concerns me. As a former practitioner, you know, I saw a lot of people that were quite overweight, and it really affected their overall health. Yeah, it causes so many medical conditions, like I said, diabetes, obesity-related, sleep-disordered breathing, etc. And it's a problem, I think, and it's a very difficult challenge that we as Americans have. And as a single practitioner, it's very hard to at least make a lot of inroads. At least in my practice, I try to, but it's a very difficult problem, and I think it needs to be addressed more aggressively.
What about the new medications that are supposed to help people lose weight?
I've not prescribed it, but in reviewing it, you know, it does reduce weight by a significant amount. You know, on average, people are losing around 20 to 25% of their body weight. Unfortunately, there are some side effects. People also lose muscle mass. That's a secondary issue. And the other thing is a significant number of people, approximately, as I've read, 50% have to stop it because of gastrointestinal problems that occur with it. Most people do reestablish that, but it does reduce a significant amount of weight. I've seen people in our building prescribe that medication and have lost significant weight. They in general feel so much better. It does affect their blood pressure. Approximately half of people who lose weight with these weight loss medicines, you know, their blood pressure normalizes, their diabetes is well controlled, their sleep apnea is well controlled. The only downside is the cost. You know, they're very expensive medications. But you look at the other side, if insurance companies will pay for that, just think of the improvement in benefits that these patients would have, or the general public would have. They would not have to be concerned with sleep apnea or their diabetes or their hypertension or the orthopedic problems that go along with excessive weight. So I think the upside is, you know, get the money, let people have the prescription and get the benefits of it.
Do we know yet whether or not individuals who've lost weight on these medications are more likely to gain the weight back?
If it is very interesting. the majority of people, it's greater than around 70%, the majority of people will stop using the medicines at 1 year. And almost the same percentage, it's close to 80%, will gain the weight back after they stop using it.
Yeah.
Yeah.
Well, I guess that's predictable.
Yeah, sure.
Because they don't change anything else.
Right.
The same, they reach the same result.
Well,
they had before.
it appears obviously that they go back to their eating habits, and it's changing your. I've not participated in it. I've not prescribed it, but reading about this as a physician, they go back to their eating habits and they stop the medication, and then they gain the weight back, unfortunately. It's a miracle. I frankly, I've talked to friends just in general because they just wanted to find out my ideas about it. I think that it's a miracle. Unfortunately, they have to try to figure out the molecular part of it that does cause the GI effects and see if they can manipulate that to help that problem.
Yeah. Well, I've been on a weight loss journey just the old-fashioned way, but it takes.
Oh yeah.
It's taken several years.
Yeah.
And it has been a totally different way of living. I mean, it's in terms of eating and exercise and everything.
Yeah.
So
very good.
It has not been easy, but I don't know. The medications make me a little nervous. I don't know, but if they work for folks, that's
I've seen some remarkable changes in people who have in the community who I know and people at work. Considerable change, and they feel so much better. Just not carrying that extra weight around.
Well, obesity is related to like multiple different health issues,
Yes.
as you mentioned. Are there any other things that are going on here that you would like folks to be aware of?
Well, again, I'd like to reiterate the importance of, as we talked about, of vaccinations. Vaccinations reduce hospitalizations, reduce office visits for people with respiratory illnesses, a significant reduction in what they call medically associated conditions that require, seeking a practitioner. And another thing I want people to realize is what we're seeing with measles. We've had a significant increase in measles in this country. We've almost had 300 cases of measles nationally. Now, nationally, that's a small number, I know, but practically none of these are unvaccinated measles cases. Almost all foreign-born. None of them are American citizens. All foreign-born, but they've not been vaccinated, and 40% of them are children under age 5. 40% of those children have had to be hospitalized. That's an enormous amount of money to care for these young children when a simple vaccine would help them. Unfortunately, in Georgia, our measles, mumps, rubella vaccines are only at 88%. So we're below the national average by a significant number of getting our children in Georgia vaccinated against measles, which is very worrisome for me. That does not reach herd immunity. So unfortunately, in my opinion, I think we're going to see measles here in Georgia creeping up gradually because of the lack of measles vaccines right here in Georgia.
It's frustrating. I know it has to be frustrating for you to see individuals on social media talking, who have no medical history or training, talk about issues related to vaccines.
Well, I think people are tired of public health doctors talking about it. I think it's just called vaccine fatigue. But we've known for a long time that vaccines do save lives. Look what's happened with polio. Granted, there are some polio, outbreaks in the undeveloped world. But polio, just think of the polio that we had just 50, 60 years ago. Franklin Delano Roosevelt had polio. And with the polio vaccine, the Salk and Sabin vaccines that were developed, you know, we don't see polio. So we know vaccines work. It's just people are tired of it and vaccine fatigue, but they do save lives. And I just strongly feel that we need to get back on track.
Probably should mention the shingles vaccine.
Very good.
Because some friends of mine have had shingles, and it sounds just awful.
It's called Shingrix, and if you've not had a Shingrix vaccine, and you should get one. And the reason is, it's from the chickenpox virus. It stays dormant in your body, and then at some point in your life, whether you're getting treated for an underlying medical condition and your immune status is debilitated, shingles can really come back through the nerve sheath that's called the dermatome. It can be very debilitating. My mother had it, and she was extremely debilitated from it. Can cause eye problems, brain problems, neurologic dysfunction from the reactivation of that
And
virus.
It's very painful too.
Very, very painful. Very painful. Yeah.
So if you've had chickenpox at some point in your life, you are a contender.
Yes, you are. Yes, you are. Get the vaccine. It's called Shingrix. Yes.
And that's been around for a while.
Long time. Yeah, quite a few years. Yeah.
Am I leaving out any vaccines that?
Well, I would I'd recommend. There's a series of vaccines for children, and I can't name them all, but there's a series of vaccines for children, and certainly for adults. But we need to make sure that our children are protected. And of course, people over age 65 with the pneumococcal vaccine and 75 for the pneumococcal vaccine, and the associated vaccines in that age population, influenza, COVID, and RSV, they really will reduce you can still get COVID or flu or RSV even with a vaccine, but your risk of being hospitalized or even dying from them is significantly reduced with a vaccine.
Yeah. And that should be good enough.
I hope so.
Yeah.
And go talk to your doctor or health department nurse. They do a wonderful job. I just love working with the health department nurses. They do a great job for us.
So we've got a couple minutes left. Tell me, 1 minute left. Folks can go to the health department without an appointment, I believe.
Yes, certainly you can.
Get a number of these vaccines.
Yes.
Find out what they need. And
yep. Our health department doesn't do everything. They have a defined practice. We don't take care of diabetes. They can diagnose it, but we're not going to treat the diabetic. That's for the private practitioners to do. We're not going to step on any toes and do that. Hypertension, heart disease, etc. But they do a great job in what they do. Breast cancer, cervical cancer awareness for eligible women, vaccines for children, vaccines for adults. If they don't have the vaccine that for you, they can order it and get it for you. And they do a great job in getting that into people's arms.
Well, we are totally out of time. Appreciate you coming so much.
Thank you. I enjoyed it. Very good.
And we'll bother you again soon.
I hope so.
Quite sure.
Thank you.
Thank you for being with us this week on Community Watch. We will see you next time. Bye now.